Hi everyone, my name's Caitlin. I'm an accredited practicing dietitian and a credentialed diabetes educator working at PDC Health Hub. The needles that we use for insulin and other injectables come in a range of different sizes. At PDC, we usually recommend using the 4, 5 or 6 ml needles, but you might have also seen them in an 8 or 12 ml size as well. For the insulin to work properly, it has to be injected into the subcutaneous tissue layer. This is the fatty layer of tissue that's just below your skin. As you can see here, I've drawn a really scientifically accurate diagram of our skin. So you can see at the top, there's a little layer that if you think of that as your skin or your outer layer, then below that, we've got that subcutaneous layer. And then if we go deeper than that again, we reach our muscle layer. So if the insulin goes deeper than this subcutaneous layer, it will go into the muscle layer, which is not what we want. If this happens, the body absorbs the insulin unpredictably. So sometimes it can be absorbed too quickly and it can cause a hypo. This is why getting the needle length correct is so important. The main places that people with diabetes inject their insulin or other injectables is into their abdomen, thigh, butt or arms. The average thickness of that top skin layer in these areas is 2 to 2.5 millimeters thick. The needle doesn't need to be that much longer than this to inject the insulin or other injectable into that subcutaneous layer. The thickness of that subcutaneous layer varies from person to person. In some people with a lower BMI, the skin and the subcutaneous layer is only 4 or 5 millimeters thick. In people with a BMI between 19 and 25, the skin and subcutaneous layer is about 6 to 12 mils thick. So if an 8 or 12 mil needle were to be used, it would likely be that it ends up in that muscle layer instead. You can see that illustrated here. The 4 mil is only going as far as that subcutaneous layer, whereas the 8 mil is going deeper into the muscle layer. Just a bit of a comparison for you. The 3 needles on the left are 4 mil needles. The one in the middle is a 5 mil, and then the one on the right is a 6 mil needle. So for most people, the 4 mil needle is enough to penetrate to that subcutaneous layer. Thanks so much for watching. I hope you found this video helpful. If you'd like to swap to a shorter needle length, speak to your diabetes educator or your GP for more information. Leave any questions or comments below, and I'll see you again soon.